Well, I think we can go ahead and get started.
Welcome,
Julie,
everyone. This is Julie Murad, and we are all delighted to have you joining us today. I think we're going to learn a lot of wonderful information, and I think we'll have the opportunity to laugh and smile as well. If the tone of the chat questions keep up, we're going to just like be laughing our heads off for a little while. We are so honored to have Dr. Travis Noto with us. He is with the Exotic Pet Vets in Denver, formerly Colorado Exotic Animal Hospital, that's undergone a name change. And Dr. Noto was raised in outside of New Orleans in Louisiana, and he attended Mississippi State University for a double major in wildlife fisheries, aquaculture, and biologic sciences. Before veterinary school, he participated in different research fields of parasitology and catfish infectious diseases. Um, Dr. Noto remained at Mississippi State for his DVM degree and graduated in 2021. Um, he's had extensive experience in shelter demographics and decided to move to Colorado. And we are so happy to include him. He has been an amazingly successful student, accomplished researcher, and when you have the opportunity to meet him, his smile and his manner are so full of Southern charm and hospitality. He currently does not live with any parrots, but he has some really, really fun exotic reptiles that maybe we'll get to later on. So this is our fourth webinar for 2026. We've got a full schedule for the rest of the year and coming forward. And as always, if you have ideas that you would like or requests that you would like us to consider for future webinars, we'll pass those on to us, please. And with this today, I'm turning everything over to Kira Vonderhaar, who is our webinar maven and go-to. And she's going to fill you in and sort of give you the ground rules and take it from there. So welcome, Dr. Noto, and thank you, Kira.
Thank you.
oh, thank you so much, Julie. Same ground rules we've had last couple of webinars. If you guys could please put any questions that you have in our Q&A, that is the easiest place for me to find all of those questions. And we'll probably answer most things towards the end of the presentation, but if there's anything that we think we should answer in the moment, I'll stop and make sure to um, go through those. Other than that, you're welcome to put like other comments and things like that in the chat, and I think that should be it. All right, Dr. Noto, thank you so much for joining us today.
I appreciate it. Thank you for the warm introduction. Let me know if you can't hear anything or I'm talking too fast. That's pretty much my number one complaint in my exams is trying to get through all the information as fast as possible. So let me know if there's any hiccups along the way. The way I'm sharing my screen, I can't see the chat, so feel free to interrupt. Like I was talking with the team before. It's not a set script or anything else. We have some cool slides and some thoughts I put in kind of last minute to cover that I think are very important and very pertinent. But I didn't really know where to put them. So we might jump around just a little bit. If you hear the cat yelling at me or the dog knocking out the door, they're products of graduating vet school with Zoom as our lecture type. So they think they need to be included. They don't, but they think they do. So we'll get right into it. Today we're going to talk about some household toxins of parrots. And then the more I was kind of think of it, yes, I think of toxins, but dangers overall. So like I said, I added a couple last minute things in there, and we'll see how this slide advances for me. If it will advance, let's see. There we go. Alrighty. So goals of today. I don't expect to make you a veterinarian. Ultimately, when we're talking about toxins, uh, I need you to understand what that hazard is. I need you to be able to identify that hazard before it becomes a big danger. Um, but once we're exposed, we're kind of in a bad spot to begin with. So, general education, what's out there, what I worry about, what I think about in exams, where I say, oh no, some general dangers around the house. Um, I have a slide at the end that just covers random things that I have seen that weren't on my radar, but are worth talking about. Um, Today, we're not discussing pathophysiology or, okay, you ate onion. How does that create anemia in the body? And in some species, what we call Heinz body anemia and suppresses bone marrow. Not the goal of the presentation. Again, not trying to make you a veterinarian, just trying to give you kind of the general overview on what to do. And then kind of talked about, we're going to try to mitigate risk. The last thing we really want to do, and I can almost guarantee you something's going to happen at 6:05 as soon as my phones go off for the night at 6 o'clock. And then what steps are we going to need to take? How do we get overnight care? Whatever that may look like. So those are kind of setting the goals for this presentation here. General overview. Not a lot of words, but a lot of content here. Ultimately, we all know that birds have a very complex and advanced respiratory system. Remember, there is an air sac system and the lung system, and it's a two-part respiratory system with, basically one cycle being 2 inhalations, 2 exhalations. That makes the respiratory toxins extremely dangerous because of the absorption that they can have, because of how fast they can work. This is also somewhat of benefit because our birds do well with lack of oxygen. They, basically have a pump mechanism when they're flapping their wings for getting air in and out. But everything, and I think this group knows, is everything that we're thinking about learning basic biology in school about lungs or mammals doesn't necessarily apply. And so if we think of toxins or we think of dangers or we think of our birds in terms of mammals, we're going to fall into a trap. And I don't think I need to kind of belabor that point here with this group, but keep that in mind. Just because we think lungs work this way or air sacs work this way is not necessarily the case. And I have a lot of clients that basically pop up Google and open up what air sacs and the respiratory system of a bird looks like, and we're reviewing anatomy in the exam room because I think that basic foundation knowledge lends to a lot of what we can learn and how to mitigate some of that risk. Same thing with the GI tract, right? Again, we learn a lot about mammals and we think about kind of the human stomach, and we have a simple stomach that produces stomach acid, and we have what we call GI transit time, so how fast from mouth to exit things go, and that's not the same. If we compare across species, maybe your budgies are going to move faster GI transit times than your macaws. Our mammals are going to be different than our reptiles. I recently did a GI study in a redfoot tortoise, which is what I have outside my tortoises. Their GI transit time is 2 months. So when we're talking about toxins, what kind of timeline do we have for exposure? Are we looking at absorption for 2 months, for 12 hours, for 2 hours? How fast is that material moving through the GI tract? How fast is it out of the crop? Is it still in the crop? Is it somewhere else in the GI tract? And all of that plays into a big factor because ultimately, the more the crop breaks things down and increases surface area of those materials, which is great when I'm breaking down seeds or grains or anything else, but not great when I have a toxin and I'm like, how do I bind all of this and stop the body from absorbing it? One thing I want to talk about, again, one of those weird concepts that we think of in veterinary medicine, but I don't think it relates to everyday life. And I just kind of wrote it as the canary in the coal mine effect. Ultimately, as tragic as it was to hear about, birds in these situations, uh, those small canaries with their advanced respiratory system, their small body weight, were used as a sentinel for toxic fumes and everything else for humans. Ultimately, you as a human with your lung system can absorb a lot more of these environmental toxins, um, respiratory vapors, all the other things, versus what a canary can. So the small size isn't necessarily the issue. It is more about metabolism, and it's more about kind of toxic dose, which I think I have on my next slide here. Is one of those ones I added a few minutes ago. And so what we know is basically you have a small bird, something like a canary, something like a budgie. You have a large bird, something like a macaw. You have, human lungs that we're dealing with. You can stand whatever next to the nonstick pan all day. Your respiratory tract is not as efficient as absorbing fumes. You have more surface area, more body area. You can dissolve that into your blood a lot kind of differently than that canary. And so if you kind of look at nebulization, which we do quite often, I think it's a good model for talking about some of these respiratory toxins. If I were to put you in a box with a fog machine or a nebulizer, you can watch, the fog kind of circulate through that box, and you can actually start to see some of that respiratory inhalation, exhalation, how those fumes and our medications and everything else go in and out of the body. What we have to think about is basically that's happening all day, every day with the air around us, right? And so the visual aspect of like a nebulization box is really nice, because you can kind of think of, okay, how is that candle, Glade plug-in, Teflon pan, smog, wildfire, how is that affecting us day to day? And yes, it might be in small concentrations, but we're all kind of stuck in this and breathing these things at the same time. So ultimately, that smaller body size, that higher metabolism, that more advanced respiratory tract, is the downfall to the smaller birds, and what makes us quite vulnerable to these things. And as a general note, many toxins affect the respiratory tract, the cardiovascular tract, or the neurosystem. Uh, when I read that, I'm like, cool. It's every important body system, and unfortunately, that's true. What you don't see on here, but is still happening, is liver. You can have toxins to the kidneys. Not too much immediately come to mind for the digestive tract, but we definitely see some of our toxins slowing GI transit time, or causing diarrhea and everything else. So, unfortunately, when we talk about toxins, it is such a broad category with vague signs. We talk about, well, what is a sign for this? If we relate it back to humans, it's like flu-like symptoms. Cool. What do you have? You're tired. You maybe have a fever. You don't want to eat. That literally leaves the door open for every disease I treat in the day. And so this is where our history of toxin exposure really comes into play, and is vital to helping understand what our next step should be. Toxic dose. This is something that we like talking about, but if you look at any publication, material data, safety sheets, things of that nature, you might find the number an LD50. That's the lethal dose for 50% of the population. And so many of like our pharmaceutical drugs will have an LD50 number published somewhere. Might take some digging, might take some calling the company to get there. And so basically, what that number is how much of that substance killed 50% of the population. And so, things that come to mind with LD50 numbers that I have dealt with in practice, fortunately not with birds, but with other species, Tylenol, ibuprofen, our veterinary NSAIDs like Remedil, all those have a very specific toxicology profile that we can measure. Which brings me to my second point, quantifying that dose in weight. One of the best things that we can do in any toxic situation is try to get how much of that substance an animal has been exposed to. That is going to be challenging. When it's something like an aerosol, it's nearly impossible. When it's something like, I don't know, a drug tablet, we can physically count tablets that were in the bottle. How many have you taken? Say it's your prescription. You have a 30-day supply and you had 60 tablets because you take it twice a day. And, it's the 15th day of the month, but you have two missing bills and your bird was around and you called me and said, I think my bird ate this tablet. Well, first thing I'm going to tell you is start counting, right? How many are missing? Because taking one tablet still might be lethal, but taking 10 most likely will be lethal for that pet. And then what we do is calculate that dose in milligrams per kilogram. And that's just kind of that standardized unit of measure, and how we dose out our drugs day in and day out in the hospital. And so kind of back to some of those other things that we just talked about, the LD50 is probably going to be reported in milligrams per kilogram. And maybe I'm making up numbers. I don't have any of these memorized, but maybe meloxicam's LD50 is 50 milligrams per kilogram, where I would probably prescribe it to your bird is about 1 milligram per kilogram. So we say, okay, that's 50 times the dose. That's impossible for my bird to eat or drink or whatever else. But maybe you're like the rat I saw the other day, where there was one ibuprofen tablet on the floor and the rat had nibbled on the tablet. And when I looked at the LD50, looked at how much this rat needed for severe kidney disease, it was 1/10 of a tablet. So even a couple nibbles from your bird, from your rat, whatever it may be, could get to these LD50 numbers or toxic dose numbers, and cause huge issues. And so, in the craziness of toxin exposure, I start asking really annoying questions like, well, how much did it eat? How much do I have to worry about? Additionally, like things get tricky when I think about things that are kind of mixed together. Um, Again, good examples are like, that I've dealt with in practice, rodenticide. And so, a dog is eating whatever. A bucket. It was one of my best friend's dog, another veterinarian, a bucket of flavored rodenticide. And she has a St. Bernard, and we were trying to do some back math, and we don't know how much was put out. It was a farm situation, everything else. Well, then I started, after I made that dog vomiting, weighing the tablets of rodenticide that we can see, and we determined that dog ate a 2 to 3 times lethal dose of that drug. And so we know that, okay, I've removed at least this much from the system. There's a potential of having XYZ still exposed. And now I'm mitigating that with different methods of vomiting and fluids and charcoal to bind or sucralfate or other things, so that we reduce how much absorption we have. And so basically my whole goal in that is to make sure any of those substances get below that LD50, get below the published toxic numbers. And so it becomes this very complicated math problem on trying to figure out where to go next. Hazards outside of your control. This is kind of in the presentation of a bunch of lists of things that I wanted you to know about. But again, I don't want to list every situation of, oh, it causes vomiting, diarrhea, regurgitation, whatever it may be. But I think this is a one that hits hits kind of close to home for me growing up as a kid during Katrina. What's outside of your control, right? I had my grandma had a Quaker that when she passed, I inherited. So, evacuating with the Quaker and chameleons and the dog and everything else, we got to plan for these things. So things that I think of in Colorado are wildfires. And I've had this happen a couple different times already in my career of, hey, there's a fire close to my home. I'm worried about my birds. What do I do? I think the best thing that we can do is have an evacuation plan, have a pre-packed emergency kit. Yeah, I just kind of pulled from the air 3 days of food and water pre-packed, because that gives you enough time to just reconsider where we're going, what we're doing. You have enough food, because inevitably it's going to spill or you're going to drop the water or anything else. How I like doing this is pack it all into like an extra carrier or whatever else. Have basically a go bag for your pets. And so if you need to leave in a moment's notice, you can. or if something, I don't know, weird happens where uh, you need a kind of a little emergency stash. You have that ready to go. And it's something where you have all the little things. Maybe it's an extra dose of drugs or whatever else packed away as well, because we don't know when these risks are going to show and how long those are going to be a problem for your bird. The smog and pollution bullet point that I have here, again, not much that we can do about that other than like, I don't know, we can say things like "don't live in the big city," right? Like, but that's not necessarily practical for many of the birds that we see. I have later on in the presentation, and there's some pretty good handouts online about airing out your house using air filters, air purifiers, types of filters like for your furnaces and for your AC, and there's even I was reading an article on only use a vacuum if it has a HEPA filter, like all kind of stuff. But ultimately, again, what we're looking at is risk mitigation, and we're not going to be able to mitigate every risk. But if whatever you turn on your vacuum cleaner and there's a cloud of dust and odor that comes from it, it's kind of very similar to smog or pollution or anything else. Let's just not do that around our birds. Cool. Now we're getting into kind of the meat and potatoes here, respiratory toxins. And the first one I put on the list here is tobacco, because I see this so many times. Um, there are countless birds that I see that when I auscultate or listen with my stethoscope, we don't sound as clear as I would like us to, or we have scant ocular discharge or mild nasal discharge. And, we like to jump to infectious things, but a lot of these respiratory toxins can also cause that severe irritation to the respiratory tract, irritation to the eyes. And frankly, I see very poor feather quality in those birds. And you have to wonder if it's from absorption of these materials, or is it, and it's probably multifactorial, coating those feathers and causing an issue there. I don't know for sure. But still, as much as we talk about, kind of secondhand smoke and changing, laws that we see in restaurants and everything else, I still deal with a lot of tobacco smoke in our birds. And I have seen quite a few birds like going from big box pet stores to a new home, and then immediately get brought to me because that bird's not acting right. And you kind of open the box and the bird smells like smoke. And I know because the store told me or the new owner told me they've only had that bird for 6 hours or 12 hours. And frankly, the treatment for that is to put that bird into some clean air and usually an incubator and maybe run some oxygen. And usually it's back to bright and alert singing and being its normal self by the end of the day. And so, for me, that was the first time I saw this happen, quite eye opening on what some of these secondhand respiratory toxins can do. Going down the list, you got to mention it in Colorado for sure. Marijuana smoke, same thing. Vapes and e-cigarettes, same thing. I don't know if anyone's had the kind of experience of having to clean like some of that e-cigarette vape like off of a window, and how hard it is. And last time I was using 90% isopropyl alcohol, and it was still leaving a film. If that starts to line things like air sacs, we're going to have quite a hard time with absorption, with oxygen transfer. And so, some of these things that seem maybe more innocent or better than like clouds of gray smoke, like tobacco or marijuana smoke, can be just as harmful. And I think the adjective I would use is more sticky. I don't know if sticky is the right word, but it is quite a pain to clean off of surfaces like glass. And when I'm making presentations like this, I can only think, how is that binding basically the respiratory tract, the alveoli? How does that stop oxygen transfer? And frankly, I have no way of knowing how the body can ever clear that. And I guess that's some of the ongoing studies that we see in human medicine, that we don't know what are these long-term effects. I had to include our regulars here: candles, incense, like glade plug plugins, diffusers with oil, all of these things that make our house smell fantastic and that we can smell, from across the room, are going to affect our birds quite harshly because of that increased insensitive respiratory tract. Not too much to add there, but if you ever kind of lit a candle and kind of whatever left it in the kitchen under the cabinets, you'll see the amount of soot that builds up and everything else. Again, when we start looking at these things, those are going to coat the nares, the trachea, the lungs, and overall are going to be bad for health. Paint, I know, they sell a lot of paints that are decreased odor and all the other things. I've had a couple birds start acting very poorly after owners repainted the house, even if they kept the bird upstairs and painted the basement or anything else. I don't have other examples of this, but things that came to mind were like primer or spray paint cans. Like all of those things can absolutely be big issues. Um,
Dr.
Fortunately,
Noto,
yes.
sorry, I have a quick question running
Yes.
back to the candles, incense, plugins, and diffusers.
Uh-huh.
We have had a couple of clients that have come to us and asked about bird safe candles. Could you talk a little bit about that? I think the big thing that we're seeing with candles that are being marketed as bird safe is that they're like soy based and that they use things that are safer for birds. So it's not chemicals because it's essential oils, but really what is one of the dangerous parts is the soot that is being created, correct?
Yeah, and so like I don't know if I have any like greater insight or knowledge or education on the candle part itself, but in my brain, if it smells harshly, if it burns, if it is putting off some type of gas, like I don't want it around my birds, right? I mean, and that goes for as much as like cleaning the bathroom. Like I don't care if it's a candle or the Clorox wipes, like it's still a concern. And so much of a concern that there's like the veterinary candles that are odor eliminating when I was working in like a dog cat exotic practice, right? Like as much as we don't like to talk about it, we express anal glands and the whole hospital smells terrible. And the girls at the front desk will light a candle, and I have a bird in 2 appointments. I'm like, going putting out candles. And I'm like, really? I was like, well, yeah. Do I think that 5 minutes of exposure in the lobby is going to be a problem? No, but I also don't want to be the problem, right? And so ultimately, I'm kind of like the no candles, no plug-in type of guy. Going back to my shelter medicine days there, my professor would say, if you need something that smells nice and fluffy or whatever else, then you're not cleaning appropriately, which like fair enough. So yeah, some magic blue Dawn soap and water goes a long way. And yes, apparently the veterinary industry thinks that blue Dawn soap is the end all be all of cleaners. Don't use any other color Dawn soap. It's a running joke for lots of people of like, why that one? I don't know. That's the one that everybody has. But yeah, so
I
I don't have any specific. I don't have any specific insight on the candles, but I'm a no candle, no plug-in fan. And I would say, traditionally, like in vet school, their training is dog and cat medicine, cow horse mixed in. And these are the same guidelines for our cats, right? We see feline asthma, we see contact dermatitis, we see our cats going into respiratory distress because they were using bleach in the bathroom. And we think about in terms of mammals how sensitive the cat respiratory tract is. And we talk about all these things not to do for your cats. And frankly, a lot of people follow it. Same thing with scented litters. Exact same thing there. Like they're basically shoving their face into this Febreze scented, dusty, I don't know, clay, right? And everyone wants to go like, okay, well, I won't do candles or whatever for my cat. But what they don't teach you in vet school is, wow, okay, now the bird respiratory tract might be 2 or 3 times, 4 times more sensitive than the cat respiratory tract. Why are we not following the same rules? Why don't we use the bird as the model of like, cool, we're doing none of these things and kind of work our way back? And I don't have the answer for that. And you kind of see, I touched on it a little bit on the bottom, cleaners, bleach, bathroom cleaners, carpet cleaners. If it's burning your eyes, if you're sneezing, I sneeze for everything, so don't use me as an example. whatever it may be, if it's irritating to your respiratory tract, to your eyes, it's definitely going to be a burn. Consider if you're whatever cleaning the bathroom, open the windows, turn on the fan, the exhaust fan. I think especially in the houses I have rented in Colorado, our exhaust fans aren't exhausting anywhere except to the other side of the room, so it's not very helpful. And so that's something, if I had the luxury of designing my own home or whatever, having true exhaust fans could really help our birds, pulling some of these toxins back out into the environment, outside. All these things have to go somewhere, unfortunately. I had a list of clinical signs. So, a lot of people like to say symptoms, technically clinical signs of veterinary medicine, because our patients can't tell us what they're feeling. The top one, sudden death. That's why I want to talk about risk mitigation, right? Like the birds that had, returned from pet stores and that kind of stuff, because they're doing poorly. That bird is unfortunately potentially hours away from sudden death, right? There is nothing I can do about that if we have a respiratory exposure and your bird dies, right? I think about this with Teflon, which I think I have on the next slide. But other things that we'll start to see is neurologic signs: tremors, lethargy, regurgitation, open beak breathing, tail bobbing, seizures. These toxins can do kind of anything that they want. The ones that are going to cause the sudden death are going to be your acute respiratory changes, and cardiovascular, right? If you were like, hey, I was looking at my bird and it fell over and died, what caused it? Heart or lungs are on my top list. Yes, those things have to stop eventually for death, but most of our tobacco smoke isn't going to cause kidney failure in an hour or whatever else. But it can create a severe inflammatory response in the lungs, and then you can basically fill the lungs with fluid and almost functional drowning. So non-cardiogenic pulmonary edema, so meaning that the heart did not cause the fluid to fill up in the lungs, comes to my mind. And we see that with traditionally, you can see it with toxins, you can see it with strangulation, and you can see it with electrocution. And those lungs have a particular pattern on X-ray, and a particular feel on necropsy.
And before we move on, we had
Yeah.
one question that was related to bleach usage.
Uh-huh. Yeah.
They are cleaning their floors with a very dilute amount of bleach. Do you have the same recommendations of just making sure that the area is very well ventilated, using like a very, very dilute amount so that it's not causing some of those respiratory kind of irritants of the eyes watering and things like that?
Yep. So when I'm thinking about like GI parasites and stuff like that, some of the recommendations we have for dilutions: 1 part bleach to 9 part water will still kill a lot of those pathogens. I think it's very important to know what cleaning products that you're using. Separate soapbox is we usually do not use our cleaners appropriately. Every cleaner should have like a contact time or something else. So one thing about bleach that is not good is it's pretty much deactivated in the presence of any organic debris. So let's just use a bird cage for example. You get the wire bottom. You make a dilute bleach solution. You spray it on the droppings on the bottom. We're not cleaning anything. We're only cleaning the areas that don't have organic debris. So what you should really do is clean it with soap and water, whatever, pop it in the shower, hose it outside, and then use that bleach solution to kind of mist the cage bars, the whatever it may be, and then let it sit for about 10 minutes. And so that contact time is really what's doing the cleaning. So yeah, things that come to mind is you'll see some of your products that are like pre-diluted. One that I know I personally use very, very inappropriately is like degreaser, right? I have like the degreaser under the kitchen sink. And if you read that bottle, I think it's 1 tablespoon to every gallon of water. I can't tell you how many times I just kind of poured it in the sink and cleaned something, right? But yeah, so dilute that bleach to a very dilute solution. Make sure you're using the bleach appropriately, because we probably don't need to use it as like a all-purpose cleaner, because it's not going to work in that fashion. And then making sure we're having the appropriate contact time, etc. Then yeah, I would exhaust fan, open windows. As my equine surgeon taught me in vet school, the solution to pollution is dilution. So the more we can dilute things out, the better off we're going to be. And that applies in so many areas of life.
Yeah, that's a good acronym. Just a small follow-up question for that. They're specifically using the bleach as like an anti-virulent. So would you have any other recommendations of something that could work or have like the same or better efficacy as opposed to using bleach? And they're cleaning the floors specifically was this one.
Yeah, no, I don't mind the bleach. I kind of like the bleach. I went on a pro bleach rant the other day at work for this exact reason. Like, I don't want that it bleeds exposure to, it was a reptile in this case, cleaning the bearded dragon enclosure. Ultimately, that dilution, it should be safe, and then I have you wipe it back out with water or rinse it or whatever else. I think everything else that comes to mind are like veterinary or industrial cleaners. You're still going to have similar odors and smells, and all the same things are going to apply. So I think keeping it simple, keeping it cheap, keeping it something that you're used to, something your bird's already used to, is a benefit. Like, kind of almost if it ain't broke, don't fix it kind of approach there. But knowing that could be an issue. If you like, I don't know, open the bleach bottle and it's burning your eyes, like, same thing with your bird.
Thank you.
Yeah. Moving on to some kitchen items here. I think, we've all learned about Teflon. The last ASPCA continuing education that I did, they cited 225 degrees Fahrenheit for the toxic fumes kind of coming off those pans and being an issue. The publication I found a couple days ago said 525. Ultimately, we know that the higher temperatures, the worse those substances degrade. But when they were given that presentation from the ASPCA Pet Poison Hotline, what their biggest complaint were people like preheating pans on the stove, and they're seeing toxicity from their and their birds passing from preheating that pan. Ultimately, you're going to see the same thing with things like self-cleaning ovens and non-stick oven surfaces and turning on the broiler. I was talking to a friend who's a technician, and she's seen a lot of toxicity with air fryers, which is not what I've seen recently, but it makes sense, right? You're going to set it to 525, whatever else. Let's face it, they're like $100 for the cheap ones or whatever. I can't imagine that plastic is the best substance to be using there. We're going to put whatever we are inside of it. We're going to leave the food burning and oils and all that for a different story. But we're basically heating up these plastic materials. Most likely, if they're going to do this cheaply and make an affordable air fryer, there's probably Teflon in it somewhere. And so, not one that I thought about particularly, but one that I definitely want to do some more investigating on. And then I put torches, right? Like, I don't know. I love a good like creme brulee. You probably shouldn't be flambeing things or making crust on a creme brulee with your bird 2 feet away. One, open flame, that kind of scares me. But again, we're putting off carbon monoxide, all the propane fumes, all of those things. Other things that come to mind, pizza ovens and gas stoves, if, like mixtures aren't right or there's a gas leak. But I think that's kind of outside of the scope here. Obviously, if there's like a gas leak, we're all in danger. It's not necessarily a household toxin. That's a whole different situation there. Heat support. I don't know how else to label this. Space heaters. A lot of our small space heaters, especially the inexpensive ones, have Teflon coated elements in them. They are all not safe. The kind of the thing about them is, yes, we're usually heating a larger area, but traditionally, what I've dug into, your radiator style heaters seem to do a little bit better. One that surprised me, and again, going back to kind of the ASPCA Pet Poison Hotline coming right out of school, the amount of hair dryers that have Teflon and things in them. And so, they cited, I can't remember how many hundreds of cases in a year of birds passing from people using the hair dryer on their bird after the bird was in the shower or anything else. I have dealt with things like propane heaters in garages and the birds hanging out in workshops and everything else. Again, maybe a niche situation there, but just because you're not getting whatever carbon monoxide poisoning or anything else doesn't mean your bird being a lot more sensitive is not having those issues. Same thing, whatever, starting your car, but the garage door is only kind of cracked or whatever. I don't know. I think of all of those kind of garage applications that really worry me. One that I have dealt with a couple times are people replacing furnaces and air conditions and things like that in the home, and then turning them on for the first time. I recently saw a family. One bird was in respiratory distress. The other two birds were acting off, but they had changed the furnace that day, and it just gotten cold, and they just turned it on. And I don't think, basically pumping the whole house full of whatever is burning off from that furnace the first time is a good thing, and try to get those birds out of that situation. Similarly, the first time it gets cold and people turn on the furnaces, not only with birds, I've seen it, but with other pets in the home. I've had cats go into asthma attacks and everything else. Those seem to be big inciting factors. And so just keep that in mind as seasons change and we move forward. I feel like we all pretty much know about heavy metal toxicity in our birds, and like, hey, birds get lead poisoning and everything else. Zinc is one of the ones I see kind of more commonly than the lead. Again, apparently lead has a sweet taste. That's news to me. I haven't gone licking too much lead, which is probably a good thing. But what we'll see in our heavy metal toxicity is usually some neurologic signs. They're stumbling. They're not gripping right. Then I start getting regurgitation and GI signs. Sometimes I get melena or digested blood in the droppings or in the feces. You can see diarrhea. In zinc in particular, you can get some blood in the urine. Other heavy metals that we test for: cadmium, mercury. There's a panel that basically tests for, I think it's 5 or 6 heavy metals through a couple institutions. I think the one we're using now is Texas A&M. But what we don't know in our heavy metals is every species of bird has technically a different normal or toxic range. So again, kind of using the extremes of a macaw and a budgie for heavy metal testing, technically they have different toxic ranges. What we tend to do is say anything over this number is abnormal. And then I kind of follow that up with like x-rays and everything else. Do I see actual metal there? One thing that is challenging with heavy metal toxicity is that these metals can accumulate in the bone marrow and be a long-term issue. So I can get that initial piece of metal out, but I might need to treat for 30, 45 days. We might have continued bone marrow suppression or continued GI signs because it is leaching from those bone marrow and from the bone itself in these toxicities. So I think we worry about acute toxicity. If I can get you through the first 72 hours or whatever of acute toxicity, and whatever it's respiratory or something else, fair. But things like zinc and lead, where I'm treating for 30 days, 45 days, repeat appointments, refilling on drugs, and those become a challenge, not only for patient compliance and those birds taking those medications, owner compliance, giving those medications, and then financial, right? I mean, ultimately, we got to consider budget when we start treating lifelong. Plants. I threw some genus names in here, threw some pictures just as common ones. Plants are hard. No matter what you are going to look up, it's going to say every plant in the world is toxic in some way. And I agree. And there's so many drugs in this world that we've made out of plants and derivatives from them. Ultimately, we have our vegetables that we know that are safe to feed, and we stick to those lists. But I would highly discourage exposing your birds to household plants in general. Most of these will cause changes to liver or kidney. Some will cause arrhythmias. A lot of our, a decent amount of our cardiology drugs have been developed from like plants of the rainforest, which is kind of crazy to think about. But things like, and that I've seen have been issues, you get a bouquet of flowers from your kid or whatever for Mother's Day, and it's got lilies in it, and your bird's tearing it apart, and that could be a toxicity situation. Or we think about consumption, but that's not always the case. There's plenty of toxicity in many species of even inhaling the pollen, things of that nature. So ultimately, I would just keep the plants away from your bird. That's the easiest way to do it. There are a couple different lists. I think like the ASPCA pet poison website has a list. Yes, it's like dog and cat centric, and I think there's horses on there as well, which is kind of odd. But in general, when we see toxicity from plants, many of them will form oxalates, which then can affect the kidneys and break down basically the tubules and the glomerulus of the kidney and cause issues there. And so you can start losing protein and things like that through your kidneys, causing kidney disease. Other will basically build up or cause toxins to the liver, and then once we start getting liver damage, we get into some trouble. The arrhythmias are particularly scary because those can be, like we talked about, causing acute death or death very quickly. And a lot of times we kind of have to let the side effects kind of wear off and do what we can to manipulate heart rate or blood pressure in terms of toxicity. But for me, those are the scariest because those are, I feel, the most constrained treating. I might be able to fluid supportive care you through liver or kidney disease. When we talk about kidney disease, we talk about acute kidney disease, so things like toxin and chronic kidney disease, so like breakdown and old age kind of kidneys. But absolutely, acute kidney disease can lead to chronic kidney disease down the road. Kidneys are kind of crazy structures. They're important in regulating blood pressure. They're important in keeping new red blood cell formation by creating erythropoietin. So we think about kidneys in terms of urine and filtering ability, but they really have a lot of, I say, odd roles in the body that we don't consider. Brings me to foods. This is kind of my list here. If you ever had an appointment with me, I'm going to tell you no onion, no garlic, no avocado. I usually leave out the alcohol, chocolate, caffeine, xylitol. Hopefully you weren't feeding your birds all of those things. Do I know many birds who have harassed their owners for beer? Yes. But hopefully don't do those. What I didn't add in here is I've gotten in many arguments about pizza, pepperoni pizza in particular, and pizza rolls. Just don't do it. That's where I'm at with it. I don't know. This seems to be a trend in my older birds, 30 plus. But yeah, they don't need the cheese. They don't need the grease. They don't need the meat. Like, just don't do it. One thing I have on here at the bottom is our dried and powder foods are kind of more concentrated. So eating a piece of raw onion and the water content there is going to be very different than eating onion powder. So if we kind of look at, again, that dose, milligram per kilogram dose, as we dry and remove the water and powder it into like an onion powder, we're getting more of kind of the harmful side of things rather than a raw onion, which has a lot of water trapped within the cells. And so, yes, technically like a fresh onion is diluted almost, so to speak. Avocado is one of those ones that there seems to be a direct correlation with how long it sits in the crop and how much manipulation in the crop to then absorption and toxicity. So, I guess the worst thing you can do is do like a everything bagel with avocado spread. So that might be the snack food that we can't have for our birds.
The most forbidden one.
Yeah. Yeah. No avocado toast. But caffeine I have on here. You can see heart effects, and then xylitol. That's a sneaky one. They're starting to put xylitol in things like peanut butter. You'll see it listed as a couple different names. What xylitol does, it's nice and sweet for us, but in most species, it causes blood sugar depression. And so much so they can go into a hypoglycemia and then therefore seizures. It tends to act for a decent amount of time. And unfortunately, by the time you're seizing, your blood sugar is so low that we're probably looking almost at kind of end of life care. In mammals, that number is about 20 milligrams per deciliter, and I see it very commonly in my ferrets. I have not seen a blood sugar that low in my birds. I know we had one in hospital that was pretty low not too long ago, but I don't think it was any toxicity driven. I think it was unfortunately advanced disease process. Conversely, we talk about low blood sugar with xylitol. Just what's the other extreme is diabetes in birds, and we don't start kind of considering diabetes in birds until about 700 milligrams per deciliter. So our birds have a wide range that they can withstand. Yes, high blood sugar is quite bad for us, but that low blood sugar is where we start getting the neurologic signs, the tremors, and the seizures.
Dr. Noto,
Yeah,
where are you primarily seeing xylitol in foods? Like what kind of foods have xylitol in them?
I'm gonna say probably your sugar-free foods.
Okay.
So a lot of those artificial sweeteners are sweet to the taste for like our taste buds, and might not increase our blood sugar, but seem to have detrimental effects. Cats don't seem to be as affected by xylitol. Dogs, it's fatal. Birds, we can see the blood glucose suppression, and so it's one of the things when we're looking at compounding drugs or anything else that I usually ask about xylitol or what vehicle they're using it in and everything else. So it should be something that we're noting. It's one of my concerns calling like drugs into a human pharmacy too is are they going to use like a xylitol flavored sweetener because it's fine for whatever kids and it's sweet, but it might be fatal for my pets. Um, and so that's just one of those like you got to talk to the pharmacist and hope they know exactly what they're doing and what we're doing. And but that's one that I panic about calling in drugs like a compounding pharmacy and why I would use like a veterinary specific compounding pharmacy or one that we use very frequently, so that we don't have errors like that. But yeah, I think of like sugar free things in general.
I think I've seen it in gum before, specifically, like sugar-free gum generally has xylitol.
Absolutely. So I literally have some like extra gum sitting next to me. I bet you this stuff has xylitol in it. It's one of the biggest toxicities we see in our dogs. Um, So this just have like extra gum sitting here. This has sorbitol, which is a sweetener, but we'll also use it in like our activated charcoal because it will increase GI transit time in some of our species, and so it's not necessarily fatal. But gum is a huge one. I've never had a bird with a chewing gum toxicity, but I have seen it in many dogs, and even a couple sticks of chewing gum can be fatal.
And in this same line of food stuff, we have a lot of questions about peanuts. I think that peanuts used to be more of kind of a staple in parrot diets, especially. But nowadays, we have a little bit more information about the potential presence of aflatoxins. And I think there's also a big difference between peanuts that are being manufactured for like wild bird use and then peanuts that are being more human grade manufactured. So we have questions about peanuts like in shell, and then we also
Mhm.
have questions about peanut powder as well. And then we had a secondary question about candies and baked goods for birds as well. So could you talk a little bit about some of those?
Yeah. I don't think I've had aflatoxins on my brain when I'm talking about no peanuts in my birds. I'm more thinking about long term health effects and liver disease and the high cholesterol and everything else. Um, if it's a human grade product, like we should be fine because whether it's a aflatoxin for our birds or for our people, either way, we're in a very bad spot. Yes, we talk about dose and exposure and sensitivities and all of those things, but aflatoxins and in general are quite potent. Isn't the word? Um, but that's going to cause FDA recalls and everything else. So yes, it's a risk. Don't use any products that have moldy or very wet, or if the packaging looks suspicious. No, I wouldn't have them exposed in the garage or in a humid, warm area or anything like that. But if you're like, I don't know, you're at the grocery store and you pick up the Planters unshelled, unsalted, or deshelled, unsalted peanuts. I'm not particularly worried about the aflatoxins and stuff of that nature. I'm more worried about like, it's not a diet that I love, and what is that going to look like long term? And I have lots of birds who are just like, I will only take my peanut and that's all. And so that's kind of where I come from with the peanut side of things. I don't know too much about peanut powder. I know there's like the PB2 stuff out there. I can't say it's a product that I buy or deal with very often, so that's something I would just need to look into. I don't really have a strong answer there. And then what's our question on baked goods? Just baked goods in general, or
Yes, candies and baked goods in general.
yeah, I think the more that we do those things homemade, or there's some bird bread recipes out there, or like I like the Harrison's bird bread packets. Um, we're trying to balance those baked goods as much as possible. And I think like if I'm memorizing the package of Harrison's, it's like a cup of water and an egg white or something like that, right? And then looking at the ingredient list, it's pretty much identical to their pellets. Yeah, that'll be okay. It's not something that I necessarily want as a staple, but I do like incorporating some of these treat items into our diet because then I can maybe use them as medication vehicles down the road. And so if I can get you to eat a bird bread, a bird muffin, something like that, that's homemade and we know all the ingredients in it, could I then add meloxicam to it or gabapentin to it and get your bird to take that because it's already something they're used to eating, and now I have an easy way to medicate your bird. So that's
Follow
it.
up.
Was
Oh,
that?
I think that's what they were using this peanut powder for, is to
Gotcha.
kind of help get this bird to eat a little bit more.
Yes.
So, and that's something that we do here as well when we're using certain things as food vehicles for medication. And
Yep.
the follow-up that we had from the candies and the baked goods was that they had looked it up and some candies and baked goods might be laced with xylitol. So I think that's just another good reason to be making things homemade. You know all of the ingredients, or
Yep.
using something that is bird specific, like the Harrison's breads and things like that, just because those have been formulated for birds specifically.
Absolutely. One of my pet peeves in veterinary medicine is always someone poisoned my pet. And do I see like intentional poisoning? Not very frequently. Have I seen I brought my insert whatever species to the whatever Starbucks drive through. They gave this treat and we've been vomiting whatever since. Absolutely. And I think it goes back to, live a little. You don't need to be paranoid, but knowing what our birds' GI tracts can handle, what our pets can handle, and just having some kind of decision making processes there. Just because it's not toxic doesn't mean it's not going to cause GI upset or be an issue. I saw a bird recently that was regurgitating, and it kind of looked like some frank blood after eating pineapple. I don't
Just
know. Like it was the new thing. They had given some pineapple the night before. Bird was off in the morning. Gave it some more pineapple with like some chop and stuff in the morning. Bird still looked terrible. And again, you're like, I can't find something on physical exam. What's new? Like, and this goes back to history. It's like, well, the only thing I added was some pineapple. I was like, well, all right, stop feeding the pineapple. We did something like a GI protectant like sucralfate, and birds back to normal 12 hours later. So back to, we talk about toxins in this lecture, but you don't have to be toxic to be a GI irritant or GI upset or something like that. And so I think that's where I go with the baked goods is knowing what we're feeding, knowing what we're giving. Bread molds, I think about in baked goods. So making sure we're airtight containers, we're freezing them, we're storing them properly. Yes, bread molds happen. They're usually like a penicillium type mold, which is what we make penicillin from, right? Not something I would intentionally feed or anything else, but in general, they seem to be relatively not a huge deal. So, if you made a loaf of bird bread and you let it sit on the counter to cool off before slicing it and putting it in the freezer, I think our risk is relatively low for, molds and aflatoxins and these things that can build up. There's nothing we can do about things like botulism, or what was kind of that big ice cream outbreak a couple years ago. These weird organisms that can survive freezing in super high temperatures, they're risks that we deal with day in and day out, and we probably have more exposure to those things than we would realize. But I can't mitigate every risk, right? And so, good food safety, good storage temperatures, mitigating humidity, which isn't necessarily that big of an issue here in Colorado, but where I grew up in New Orleans, like I don't know, I visited my mom over the weekend for Mother's Day. Got off the plane, you can like smell the kind of the earthy, I don't even know what to call it, and you're looking at every side of the house, and there's kind of green mildew kind of stuff growing. All of those are fungi and things that are going to be a lot bigger of an issue down there than we're going to deal with here. And so, leaving things exposed to that much humidity and heat, yeah, you're going to have a chance of growing more molds and aflatoxins and all of those things versus whatever, desert in Arizona, at elevation in Denver, whatever it may be. Other questions? Got over there?
I think that was all of the food related questions that we have right now.
I think we're kind of winding down the presentation here. I got some vet stuff, real world examples. I feel like I worked a lot of these in. You can read this list here. I added this first bullet point right before I jumped on additional pets in the home. I've had, we talked about household dangers. Obviously, our other pets aren't necessarily a toxin. I have had too many birds like playing and have good relationships with the dog or whatever else. Dog sleeping on the couch, bird goes and bites the dog freaks out, bites the bird, right? That has been a tragic story a couple different times in my career. The other one that really worries me is like the Amazon guy rings the doorbell, bird flies, dog runs, cat runs, and again we have another trauma situation. And it seems to be time and time again there's that unknown trigger in that situation. And so just keep that in mind. I don't necessarily worry about our birds out on a play perch or whatever else, and especially if they get along with the other pets in the household. But it seems to be the time where company comes over, someone knocks on the door unannounced, the Amazon guy, the fire alarm goes off, where I get a lot of trauma situations and just a concern as a household danger. Weird things I've dealt with in my career. I had someone who had an indoor pool and their ventilation system went out, and like the chlorine smell caused death in the bird. Again, that very harsh chemical smell. It's irritating to the respiratory tract. It caused significant damage and death in that bird. One I kind of alluded to earlier, I had a cockatiel chewing on stained glass. And so basically, I think the owner either did it as a hobby or as like their full-time job doing stained glass, and the bird would like nibble on and lick the flux between the glass pieces. And that bird had a significant metal values when I did heavy metal testing. And so how do you fix that? I don't know, right? Like don't let your bird lick the stained glass. But it has been a thing a couple times in my career, not pair related, but I had a house chicken. Owner would make jewelry and the chicken would find all the little jump rings. And so I think I counted 20 little metal jump rings in that bird. It had zinc toxicity. I do see the same thing with like our birds who are just curious, and I don't feel like it's necessarily my bigger parrots, but like cockatiels. I feel like they like to play with those little metal rings and things of that nature. Yeah, and again, I don't have a way to mitigate that other than like put away your hobby supplies, right? Maybe you don't let the bird in the spare bedroom where you have a desk where you make jewelry or something like that. And a big pet peeve that I have is my next bullet point. I've seen so many birds like on the shoulders of an owner at a gas station. That just freaks me out. It makes me do one of those I don't see anything, I'm not looking thing, because that's not the conversation I really want to have at the gas pump, or as my favorite saying, especially when I visit homes, I'm not licensed in the state. I can't help. But those things scare me. Now, I have had significant conversations with owners about them road tripping or they're moving across the country, and what are they going to do when they stop for gas or whatever else. And I think we do the best that we can. Maybe we open the windows to vent the smell out. Maybe, we put recirculating air on in the car as soon as possible. but that's going to be a kind of on an individual basis. And then kind of touching on it again, because it's been a big issue of mine, is tobacco smoke in the home, right? And I've had a bird very recently that I've dealt with that um, with, and I see everything from poor feather quality, poor skin quality, respiratory disease, swollen eyes, and who knows what it's doing to the cardiovascular system. But everything we think about and kind of secondhand smoke in people, I think about my birds, but maybe magnified multiple times because of kind of their advanced respiratory system. You will also feel that those birds have kind of that kind of soot feeling on their feathers and on their skin. And it's something that lingers with you. And so not only are they getting the respiratory effects, but they're getting the tobacco absorption in that nicotine as well. Mitigation, I kind of talked about this throughout the presentation. Increasing ventilation, opening windows, using an air purifier, prevention and education. That's why we're here. What are some of these things that we can think about, and how we're doing things, and how do we change things so that we don't get in these situations? Like I started this presentation, it's not the time to talk to you about Teflon toxicity if your bird has passed away because we were preheating a pan on the stove. I'm going to have to mention something like I want that to be like a safety point, but that's not the time or place to have the, well, I wish I would have known conversation. Being proactive in that education is going to be best. Consider boarding or hospitalizing. So I've had this a couple times, changing the furnace, wildfires, painting. Sometimes the easy answer is, let's get the bird out of the house. And immediately my owner's like, what about the stress? And what about all this other stuff? Yeah, it's all a factor. Maybe they don't eat well, anything else. But let me tell you what, I can manage your bird's food intake or whatever in hospital a whole lot better than you worried about repainting your whole home, right? I can get the bird out of that situation. Maybe that's bringing the bird to a friend's house. I did have a couple issues with like infectious disease where a family member watched my bird. They also have birds now. Everybody's got respiratory disease, or everybody's been exposed to chlamydia or AGY or something like that. So definitely consider and be scrupulous with where you're housing or boarding your birds in that situation. Because I call that stupid bad luck, right? We try to do the best thing that we can and avoid a situation, but unfortunately we chance into something just as challenging. But consider that as an option. Changing air filters. I was reading an article about basically all the different style of air filters that you can put like in your furnace and in your AC unit. Do with that as you wish. I know I kind of added a more beefed up filter and it kind of messed up the AC, and then the air conditioning guys put a cheaper one in that has better airflow, but change it more frequently. And so, I think that's going to depend on kind of your home ventilation system and then what you're actually trying to filter out. But you're not going to be able to filter out, a lot of these toxins and stuff like that from a candle that's in the kitchen or whatever else, and your bird's 10 feet away. This last bullet point is something I added right before I jumped on again. Is I know we like to give our bird things to open and play with, but one thing that I think would probably be a poor idea is something like a pill bottle. I don't need my smart birds, my grays, my cockatoos, whatever else, figuring out how to open a pill bottle, and now they have the opportunity, if unsupervised or you walked away, to then open a prescription drug. Right. So let's keep that one just like a human little secret. Like you don't need to know how to open that. They can play with anything else though. Here's my vet spiel. We're exposed to a toxin. Now what? It's all about how long has that exposure been? How can I decontaminate? What can I do? What are next steps? How long does this toxin last? How fast is the metabolism? And so if you told me I've been at work 12 hours, whatever, it looks like my bird ate whatever these pills. Like, well, unfortunately, we're probably in the thick of it, and it's already been absorbed, and we already have metabolism going on, and now I have to respond. If you're like, I just watched my bird eat a penny, I don't know, pick something silly. I can say, cool, let's get here. Maybe I can anesthetize your bird and scope it out. for all of our drugs and toxins, we can call that ASPCA hotline, and I put the number here. They most likely will charge you a consultation fee. I think it's like 135 or 150. But what that does is they basically start to look into their catalog of toxin exposures and consult with the veterinary toxicologist on next steps. This also gives me an opportunity as a veterinarian to use that case number to then consult with the toxicologist on how we want to treat, what drugs do we want to give, what fluids we want to do, what oral meds do we want to do we need to go to surgery, do we need to evacuate the crop, do we need to just monitor. And so that is money very well spent. And I have had owners call, and dogs and cats at least, and say, hey, my dog ate a slice of chocolate cake that was whatever Betty Crocker, and just newsflash, that has very, very small amount of cocoa in it. And they say, great, that's fine. You're going to monitor for GI upset, and there's no reason to, go be hospitalized. I say more frequently the opposite is true, where the ASPCA hotline is like, get to an ER now, get fluids, get all these other things. And so the next step after, they kind of need to be at the same time, is call your veterinarian, but also check in with that ASPCA hotline, and then we'll kind of manage this together. Like we talked about, time is of the essence, which kind of brings me to my bullet point at the bottom end of drive safely and calmly. Don't chase your pet around the house. Try to decrease the stress and anxiety, because the more we get worked up, say it's a respiratory toxin or a heart change, and now I start pushing that heart rate higher and higher, we can get into some big issues and go into cardiac arrest. So it's hard to stay calm in these situations, and I know that's asking a lot, but the more we can kind of systematically go through this, collect the information that we need, try to, like we talked about in the beginning slides, how much did we consume, what can we quantify in these situations, the better outcome we're going to get. And, we may request that you go to an emergency room or a veterinary teaching hospital, or, things happen. I only have so many oxygen cages. I only have so many sets of hands, and these things are time sensitive. So what might be best, if every oxygen tank I have is taken by a patient, to send you somewhere else for initial stabilization, and then we can do follow-up care or something else. So I would say, especially as veterinarians on my team here in Colorado, like we do not take referring you out somewhere else lightly. I know we want to help every single person that we possibly can, but sometimes it's what's best. So just consider that. What to expect once in hospital? Most likely we're going to do fluids. We're probably going to do some type of assist feeding, gavage feeding. That might be with like something to bind an agent. So maybe it's like sucralfate to coat the GI tract. Maybe it's we're making like a slurry of like an omnivore care and fiber to push things and bulk things through. Depending on the toxin, we're probably going to be in an oxygen incubator or oxygen tank of some type, so that we can help increase the oxygen absorption in these respiratory toxins. Anti-inflammatories, we talked about non-cardiogenic pulmonary edema. We talked about inflammation of the eyes. We talked about basically the trachea being irritated or swelling closed. Those anti-inflammatories or NSAIDs can help open up those airways. Again, toxicology consult. We have veterinary toxicologists that's their whole job and whole career and specialty after vet school, is they usually come with like a PhD as well, to talk about, hey, this is the plant, this is the drug, this is how it affects the body, this is what we're going to do in this species. And the SPCA hotline can really help us with that. Kind of mentioned binders here, charcoal, fiber, sucralfate, surgery. So can we get things out of the crop? Can we do we need to do coelomic surgery? Can I scope things out? Is it something that's been sitting there and has kind of had maximum absorption? I don't need to get out. I don't know. And I mentioned heavy metal testing. If we are heavy metal testing and we get a positive result, we might have 30 plus days of treatment. Look at heavy metal testing again down the road, and that's where that long-term management comes in. Through some owner resources, anyone who's ever met me knows that I'm a huge fan of AAV, the Association of Avian Veterinarians. They have these two handouts I kind of screenshotted here: Household Dangers, Environmental Air Pollution. I love these two handouts. They are on their owner portal, which is free to access. I thought about throwing the QR code here, but I forgot. But AAV.org, right side, there's like a little blue box that says bird owner resources, and then I think it's under client handouts or something like that, education handouts. There's 28 handouts on there. I think 6 videos or 4 videos, and a couple handouts on like UV light. I think it's a 7-page handout and like a 56-page handout on making toys and enrichment for your birds. And they talk about some safe options there as well. Um, Other places, Harrison's has a good reference for education stuff, and then Lefebvre, they not only have their company website, but lefebvrevet.com, which you can actually log in with your veterinary license, and they help to educate other veterinarians and kind of how-to guides. So I've directed a lot of my friends across the country to like Lefebvre Vet in case of emergency, like, hey, really good client. They call, they have a bird I've never seen. This is an emergency situation that's happening. Can you talk me through this? I'm like, heck yeah. Also jump onto this website and they have videos or how-to steps. So there are a lot of resources out there, not only for my owners, but for veterinarians. And if you're not, local to us, or you don't have a kind of a bird specific hospital or something along that line near you, then there are some options that I can kind of point your local vet to. And I think with that, a little bit over an hour. Sorry about that, but happy to answer any questions.
Myself. Yay, thank you so much, Dr. Noto. That
You're
was a
welcome.
lot of really good information, and we have a lot of questions.
Yeah.
So I'm going to try to maybe combine some of these. Let's see. So there were a lot of questions about household appliances. And in your presentation, you had talked about some of those common ones. So the furnace and the space heaters, hair dryers. And then this question asks specifically, are there any kind of sneaky or hidden appliances that you think people may not realize or think of when they're thinking about appliances? We had someone comment that I thought was funny, but also very true, that their panini press has been exiled to their garage because it has a non-stick coating. So do you
Yeah.
have any kind of like sneaky or maybe unknown appliances?
I mean, I feel like the toaster might be one as well, right? Like, I think the air fryer was my one that I really didn't think about, mostly because I just don't have an air fryer, and it's not one that I typically use. Things that come to mind is not necessarily appliance specific, but when I start using those household appliances, like what's that burning plasticky smell, right? Those are the ones that really scare me. Um, I don't know much about like coffee makers. Like those are probably fine. Those are pretty contained. Electric kettles, I think, are all pretty much enclosed heating elements or like copper heating elements. That doesn't come to mind. This just comes to mind because my dad was doing it when I was visiting my parents last weekend. But 3D printing, like I don't know what kind of fumes or where the melting that kind of plastic. I don't know what it's called, filament, I guess technically. I don't know what kind of heating element and fumes are coming from that. So those are things that I'm just like, heck, I don't know. But yeah, no, nothing specifically.
I would say one that we have here at the aviary is our laminator. For when we're laminating different things and
Yeah.
you're putting in the plastic sheets and
Yep.
heating them up. So we use those in ventilated areas and make sure, because you can always tell if the laminator has been left on because you can smell it.
Smell
Um,
it. Yeah.
yeah, that one. And then I've also read some people, if they have like a heated humidifier, specifically a heated humidifier,
Yeah.
because it has the heating element that
Yeah.
generally has some sort of Teflon that's helping to heat that. Um, but one of the things that we always recommend for people, adopters and clients that we have with these questions is calling the manufacturer. A lot of the times you can call directly and ask about the specific appliances, and they can give you more accurate information about the presence of any of these kinds of coating.
And I think it's somewhat important, and I don't want to kind of back out of my presentation, so to speak. But like, how many people, whatever, use the air fryer or the toaster and they never have an issue because their house is ventilated enough and it's further enough away from the bird and the bird's in the other room or whatever it may be. Uh, and life goes on and we don't think about it. And that's a fair kind of point or assumption to make. Um, but it only takes one person losing a bird that didn't know that whatever the hair dryer could have been a problem, and ultimately we're trying to save those lives. But yeah, I have people all the time in appointments telling me, "Well, I've done that for 20 years." I'm like, "Well, cool. Here's 19 case reports that it's fatal, right?" And so there's always the exception to the rule. I think we can definitely get bogged down on like the how do I make life in a kind of in a bubble and as safe as possible, and it's not possible. And so like I don't know, we've been using the same toaster for 25 years, like it's probably not the problem, right? But the new toaster might be, right? Like you could like, oh, I bought this awesome toaster at like a Black Friday sale and now my bird's acting weird. You never know.
Well, one of the comments here says laser engravers are notorious for having fumes, so highly recommend to be ventilated. Yeah, that's something that like I wouldn't even think of, but I think when you're a bird owner, your brain kind of switches, and then when you're at Costco looking at all the cool appliances there, then you can be a little bit more discerning because then there's something in the back of your head going like, "Oh wait, would this be safe for my bird?" So we definitely encourage everyone to just do a little research. And also, if you're unsure, you're welcome to contact us. You're welcome to reach out to your veterinarian and they can probably give you some good information or at least direct you in the right place to look for that information.
Yep.
That's
And like I know, like in terms of like little space heaters and stuff like that, like I know Dr. Fitzgerald, she's like, here's my favorite brand. I don't know if I have like a favorite brand, but you just like, hey, Dr. Fitz, send me that link to the space heater or tell me your favorite whatever, right? And it's one of those things that you come with time and experience of like, this is what I've used because I've always used, and inevitably it's discontinued, and then we start this process all over again. Yeah, I don't want to create kind of fear or paranoia, but just kind of a general understanding and risk mitigation.
Mhm. In the same vein of appliances, cookware, things like that, we had a question about the PTFE free and ceramic cookware. Um, I know Julie and I both use ceramic cookware because it has some of those non-stick properties of actual like non-stick cookware without having some of the chemicals. One thing that I have read about the ceramic cookware is that if the ceramic, because it's like a ceramic coating on it, if
Coating,
that
yeah.
gets damaged in any way, then sometimes there can be chemicals underneath that that can cause issues. Have you experienced any of that or know
I
anything about it?
haven't, but I haven't. But then it's like the same thing that you read, like if you whatever bake on aluminum foil, like or is your like level of aluminum in your blood going up, right? Right. Like I think there's absorption with any time we're heating up a metal and everything else, but um, I kind of take that back to, I have people like, what is your favorite brand of water to give your birds? And I'm like, I don't have one, right? Like if, I'm whatever, my pet's in my own home, if I'm drinking the tap water and it's good enough for me to drink, then usually give it to them type of deal. Do I have owners who are like, we are hospitalizing a pet, whether it's a bird or ferret or anything else? I'm like, here's the bottled water and this is the only water they drink. Absolutely. Am I to that level of like I worry that much? No, I don't. And so, kind of the theory that I've taken when I was living in Loveland, every now and then I turn on the faucet and it's like kind of a yellow and smells like chlorine. Okay, well I'm not drinking that. The pets aren't getting that. Maybe that's where I have a couple, whatever spring water bottles stashed. Then you can go down the rabbit hole. Like, what plastic are they using for the water bottle? Was that stored at a proper temperature? Is there something leaching out to that point? So, at some point, for my mental sanity, I'm just like, cool. This is what we're doing. Um, I did the best thing I could and find the ceramic cookware. Make sure the lining it's not chipped or anything else. Because it is iron and whatever else underneath. Yeah, there is absolutely opportunity for that to leach out into food or anything else. But what is that kind of long term problem? Yeah. Is it, I think your ceramic cookware is going to be chipped in a way that it heats and creates a vapor and hurts your bird? Probably not. I think we're getting into, parts per million versus parts per billion, back to that toxic dose, but something to be aware of. And just like, I don't know, go back to the college days where I look at the, kind of the QVC HSN bulk pots and pans and like the Teflon layers chipping off, and you're like, wow, uh,
Yeah,
survived, right?
yeah, but you're still here.
Yeah.
And then Sheila, in case you were curious, the ceramic cookware that Julie and I both use is the Caraway cookware. And we haven't had any issues with that. We are both in the kitchen voraciously cooking away. So I think that those ones are pretty safe. Can't speak to other ceramic cookware. That's just the one that we've tried. We both like it. Let's see. There was one question that I thought was really interesting. This was talking about the heavy metal poisoning, and this person asked, are there any sneaky sources of zinc and lead poisoning in a standard home that homeowners usually overlook? The first one that would come to my mind is like paint, because my birds do be chewing at the baseboards and things like that. And so if you're in an older home or there's older paint or something like that, I think that could probably be a lead poisoning source.
Yeah, I think it might be sneaky for maybe most of our pet owners, but that's something we talk about quite often. Like, where did this bird get lead from? Anything else? And like, how old's your home? Like, I'm asking like these random off the wall questions sometimes in my histories, and people are like, what? And I'm like, I had this one case one time, right? Like, one that I was literally shaking my head at. Dr. Fitzgerald and I were chatting in the doctor's office one morning, and we were just like laughing at, like, my grandma had a bowl of like the beaded fruit on the table. You know what I'm talking about? Like, I don't even know, like the decorative, just like little fruit centerpiece. And Dr. Fitzgerald starts laughing. She's like, I had a bird who's picking those little beads off, and in the center of those is lead. And she's like, I had a lead toxicity from the beads of like the beaded fruit bowl. I would have never have thought that. Like, the last thing that came to mind. But it's one of those things that, then you're like, huh, what is in that? What's going on that I don't know or I don't think of? And I don't know. Those are the sneaky ones that you live and you learn. And unfortunately, that's kind of I don't want to say a regional, but like, unless you've had that experience, like, that's not going to be knowledge like it's like widely disseminated. You know what I mean?
Yeah, that makes a lot of sense. Let's see.
I wanted to add one thing on the caraway, the ceramic cookware. Um, Having been a professional cook for many years of my life, I'm used to using a variety of hard surfaces um, to cook on. And I think that one of the things we have to be careful, and Dr. Noto certainly touched on this, that if you are using a fry pan, stainless steel or cast iron is very much back in vogue, and using those at high temperatures with generally a high flame point oil. When you cook uh, especially meat, but it could be other items as well, that a lot of smoke can be generated in your kitchen area. Um, for many, many years, it used to be said that birds should never live in the kitchen. Well, a lot of architecture has changed, and we have big, great areas where we have seating and we have cooking areas and we have lounging areas. So that if that is something that you're going to be doing and you have um, the possibility that you can have that heavy kind of uh, fume that's visible, it'll certainly set off your smoke alarm. You may want to put your bird in a crate or a carrier and put it in another part of the house. It happens during the day, and it's a wonderful day then, and you've got outdoor safe outdoor housing for your bird, put them outside. But I think that's something that's extremely important. And also with the better brands of ceramic cookware, there is always um, absolutely a caveat that comes with those pans that they do not even recommend, the manufacturers do not even recommend cooking on high heat with those surfaces. So I think paying attention to that is really, really, really important, because even the safest product can potentially overheat, and we may just not have enough experiential information about how that's going to impact our birds. So that before you go to set up your grill or doing anything like that in your house, make sure that your birds are in a safe place away. And especially this summer, as birds are outside, maybe in their outdoor flights or enclosures or cages, and you're grilling, you want to be careful about all of that smoke and fumes that certainly sets things off. I remind people that it's really, really, really helpful to do that. And as we're talking about that, for those of you that have smoke detectors or carbon monoxide detectors, if they're highly sensitive, this is a great time to think about, and depending, of course, on the number of birds that one lives with. But here in Colorado, we're in a dry, high altitude, dusty area that happens naturally. I strongly recommend to everyone that they get some canned air and they blow out their smoke and CO2 detectors. I like to do it on the first of the month. Really, really, really important. And if you furnace or heater as AC, as Dr. Noto was talking about earlier, make sure that your filters stay clean. And if you have a lot of birds, like I happen to share my life with a lot of birds in my house, I make sure my filters are changed once a month. It's an easy thing. It's not particularly expensive, and it is worth its weight in gold to feel comfortable and that your birds are going to be safe. So really, really important to read those manufacturer's instructions. And as Kira mentioned earlier, if in doubt, contact the manufacturer. Many of you may not have been around when Febreze came out, and there were, Dr. Noto will probably remember this, when there were all the bird scares about using Febreze and other kinds of air fresheners. And there was like, oh, Febreze is safe, Febreze isn't. Ultimately, Febreze came out with a statement on its impact with parrots and their respiratory systems. But but you can find out and go to those sources, which is really, 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 really important. And this time of year, there's one other thing, and I bring this up because with 250 or so birds, we're always making new perches and we're adding different kinds of woods. We don't necessarily know where all that wood comes from. Oh, on our website, we do have our bird safe woods and trees. We also have our safe and toxic plants list, so you can go there. But one of the things that doesn't get mentioned is whether or not those leaves and branches have been sprayed with a pesticide. And you want to be truly, truly careful with that. If you feel that you want to scrub your wood in the branches, you can use a Dawn and water soap solution, and you can use a sponge and gently clean them off and let them air dry. Here in Colorado, it's a piece of cake because we have so much sun. But for those different types of trees that have been sprayed, you want to be really, really, really careful.
And for everyone that has been asking for the safe woods and how to sanitize them. All of that information is in our enrichment webinar specifically. And I'm happy to rip that slide from the presentation and just send it to everybody. But that has very detailed instructions on how to properly sanitize the wood, and it has a big comprehensive list of all of the safe woods. So I can send that to everybody in a follow-up email. We'll try to get through these last two questions, but they're related to two things that we were just speaking about. So we had someone that was asking about um, what kinds of filters work the best. And let's see, for dander from their twos and their teals, so two very dusty species. I think the air filter would probably depend on like the specific unit of like if it's the filter for your house itself versus if you're working with like a room air purifier. But do you have any recommendations there specifically?
I don't have any like brands, but one thing I find kind of deflecting the question almost is when we get proper temperature and humidity for especially those two species, I find that their skin quality is so much better. Their dander production's reduced. Um, and I, especially many birds in this area and practicing in Colorado that tend just to be a lot drier, more dandery than I saw growing up in bird hospitals in like Louisiana. Uh, um, and so that's one thing I try to think about. And it kind of goes back to my background in reptile medicine, right? Like, okay, what is our kind of our native range? What is the ambient humidity that we're used to? What is that temperature range? And we might not be able to make that perfect, but do I get better skin health and less dander and everything else? And then therefore, where I usually see this is less having to like pick out nairs and everything else. And so like if I can cut the problem off at kind of the start, well, then do I have to use less filters and stuff down the road? And so maybe that's more showers, maybe that's a humidifier, maybe that is running humidifier and an air purifier, which many times if I have someone with a bird room, especially here, it's usually some part of my recommendation. Um, but yeah, I think if we start looking at some of those kind of quote unquote native range temperature, humidity settings, then I get better results. I have had people like, okay, well, I've done that. Now I'm worried about growing mold in the bird room. Like, fair enough. I do not think we need to make it a tropical rainforest in the bird room. But, changing it from whatever, 20% humidity to 45 to 50%, something like that, which is something I talk about day in and day out and all day in reptile medicine, I think gets a little bit overlooked in bird medicine here.
That's really interesting. And we always refer people to look at birds in the wild and look at their more natural habitats. And so I think that's a really interesting piece of information of like, look at the relative humidity of where they're living in the wild. And that's probably going to be really beneficial to trying to not exactly replicate, but replicate some aspects of what they're used to in the wild. Um, I think that's really
And I'd like to just say one other thing while we're talking about this. This is always a great time to take an assessment of the air purifiers that you have in your home. For years and years, we have recommended three. We really, really like the Austin air filter. They are expensive. Replacing the filters and the pre-filters is costly, but those particular machines will last 20 to 25 years if they're properly cared for. So you have to look at each one of those as an investment in your bird's health and your health as well, because we didn't even get to this part when we have humans who have bird dander related disease. And we see birds coming to us because people have ultrasensitive pneumonitis. We see some of our own birds, cockatoos that are with macaws, especially scarlet macaws, and scarlet macaws have an almost asthmatic reaction to the cockatoo dust and dander. So it's not just like, oh, let's clean the air. It's really effective. We also highly recommend blue air and we recommend rabbit air. And they've got good accessible filters. The companies work with people who care about birds, and I think it's really wonderful to support them. I recently, just a couple of weeks ago, purchased a new air filter, and I'm very curious now continue communicating with the manufacturer. It is a Shark
So
air filter. Costco had some of them. They're in the 300 plus range, so they're not an inexpensive item. But the filters can be changed by vacuuming them out, which is makes it easier to change them. So if you've got a special birthday coming up, an anniversary, and you want to celebrate it with you and your birds, invest in everybody's health with a good air filter.
air filter. That's a fun one. All right. One more question here. And this is something that we deal with at the aviary a lot. So we probably have some good recommendations for this. This person is asking for a homemade pest control spray or a bird safe spray that kills ants. The ants are not near their bird's primary space, but they discovered them in another area of the house.
I can
Um,
answer that as borax. All you have to do is sprinkle powdered borax. It's incredibly effective.
Mhm.
And
Does diatomaceous earth also work with ants?
No, they're not gill breathers like ants.
Okay.
Diatomaceous earth is nice for all those nasty, pesky cucarachas and stuff.
Roaches. Yeah.
Earwigs.
I would
Well,
Um,
think
Dr. Noto, certainly living down in Louisiana, you deal with this
yeah.
far
You should
more
know about
than
when
we
you
have
hear
in
the
cucurbites.
ants
the
crawling
Midwest.
across the floor before you see it, we have an issue.
Yeah, yeah,
I would
yeah.
go back to the ant question with like what this is a big nerd in me. What species of ant are we dealing with? Right? I mean, is this something that we are um, like? Uh, is it a food source issue? Is it a environmental issue? And can I clean up or change the environment to where it is not habitable for the ant? Right. And so let's eliminate the pesticide or anything part of that. Can I do mechanical removal? Can I vacuum them up? Can I sweep them up? Can I remove that food source, whatever's attracting them to that area, and just prevent everything else? So I mean, sometimes even just like we're talking about a dilute cleaner. Many of our basic like all-purpose cleaners can basically break down some of that exoskeleton and effectively dehydrate out some insects. And so, we might not need to do anything super fancy to take care of a small problem.
Well, and I've got one more little thing that inspires something. When you have parrots, you invariably get mice. And the longer you have parrots, the more accessible your parrot buffet becomes to mice. There is a product you can get through Amazon. There's a store on Amazon, and it's called Vamoose, Vamoose, and it is a safe spray. You can use it around the birds. You don't want to spray it necessarily on the bird's cage while the bird's in it, but it's got a many different herbs and natural repellents in it. We like that a lot. If you get those pesky areas where mice want to eat through the drywall or anything like that, we have found that you can use steel wool or copper wool. But one of the very best things that they like even less is stick a dry Brillo pad in there. And that's a great deterrent to them. And I think the reason I bring this up is that out where the Gabriel Foundation is, we see a lot of beautiful raptors and wildlife. And when people are poisoning the voles or the mice or whatever else they have, then some of that wildlife picks up and eats those carcasses or whatever, and then it's a terrible tragedy. So you want to be really careful. I think the word is the half-life of those toxins and what it can do to your own pets potentially, let alone wild birds, let alone areas where refuse of those deceased animals is disposed of. And I don't know, Dr. Noto, if you want to add anything on there.
Yeah, and so in terms of like mice, rats, those situations, I would kind of refer to the AVMA, American Veterinary Medical Association, and their guidelines on euthanasia, which kind of seems like a weird place to point, but something like live trapping and relocating, and then we have to talk about distances and everything else. But I am very kind of anti rodenticide toxin deterrent. Whereas if you look at some of your immediate like snap traps that cause immediate death, and that is usually through basically a process like cervical dislocation, is considered humane by the AVMA because it's instantaneous. And so that eliminates the poisoning a raptor, drugs on your property aspect of things. And I know it's not one that we like to think of, but instantaneous passing is considered humane, and you look at it across the board in many different species. And there's I think it's 90 pages from the AVMA on on euthanasia and death and what's humane and what's not. Everything from mammals to birds to reptiles to even our fish. Now we all have a position statement on. One that I am very adamant against is actually glue traps, right? And so that is not instantaneous. That is, you get quite literally glued to a surface, and then unfortunately that's starvation. So if we're going to look at physical removal of some of those pests, like a snap trap or a live trap and then relocation is usually my recommendation, because there's so many products out there that we don't have a ton of information on. And I can't give you the, hey, this product's going to be safe, but this is not, because inevitably, if you have something, like I told you, one of my best friend's dogs is a veterinarian. Her dog's at our dad's house and eats a bucket of rat bait. The new rat baits are bromethylene based, and that causes brain swelling within 4 hours. There is no reversal. There is no antidote. Like either you ate enough or you didn't eat enough. And so having drugs like that, no matter in what form of fashion with any species around the home, is always scary for me. So not something that I necessarily like thinking about, but a safe and technically humane way for removal of those species.
And we have also kind of transitioned to trying to use some of those more humane forms of pest control, including snap traps. And one of the things that we had to consider is that the snap traps could injure our birds here. We have small flighted birds. At home, I have birds that will walk on the ground and check those kinds of things out. But we actually purchased their like little housing. It's little cardboard housing that encloses the snap trap. And so that the rodents can still go in, but then it's a lot safer for your birds. And that has been working pretty well for us. Alrighty. Well, I think that was the very last question that we had. We wanted to thank you again so much, Dr. Noto, for coming on for your very first TGF webinar. I think it was
Appreciate it.
great.
Thank you.
People said this was a really informative session. And a lot of it just reinforces things that like we've maybe heard or know a little bit about, but it really just goes to show how important it is to consider the real hazards of these things in our households. So, yeah, we really appreciate having you on today. Thank you so much.
I
And
appreciate
thanks to
you having me.
everyone who attended too.
Yes, yes. Everyone here, avid learners, I think it's always great when you have people coming on and wanting to do better for your birds. It's always a really good opportunity to just learn something new. I have a whole list of new things that I learned today, so really excited. We're excited to have you back on for another session, so you'll have to start thinking about what you want to present on next.
Yeah, I'll have to do some writing. I'm open for topics. I think it's one of the hardest things. We talk about so much in appointments, and I find exotic veterinary medicine by far is not taught in a vet school or a classroom. There's so much I do throughout the day that has no textbook, and some of the stuff. Happy to, if you have questions, we can dig and put some brilliant minds together and pick some of my mentors' brains and present again.
Awesome. All right. Any last thoughts that you would like to leave us with, Julie?
I just really appreciate the opportunity to work with everyone because our motto for this year is when we know more, we do better. And that is our goal to really be a terrific educational resource. We so appreciate it when you refer people to our webinars, to our site. It helps make us better. We're really excited about a lot of the things that are coming up as we're continuing to work on our website and our webinar series. Kira keeps that posted, puts it out there, and we really, really love to hear from you about what's important to you and what would work. Okay, so thank you.
Alrighty. Well, I think with that, we'll sign off for today and then we'll see you again soon. All right. Thank you so much, everybody.